Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's cold, but it's pretty outside. You need to go for a walk, but after you listen to Dr. Tom Roselle Live. If you've had a problem, you've tried, you've applied, well, this is an opportunity for you to put the fire out, so to speak, find out what really works from a non-drug, non-surgical point of view. We look at things from a question. What's the question? Why is that? Why does something really happen? And today we're going to talk about that in depth, but not so much of the triggering mechanisms, but how the body really is affected in so many different ways. You know that we specialize in a very interesting area called applied kinesiology, which means the application of neuromuscular responses in the body. But in applied kinesiology, there's this one piece that we apply that everybody talks about, but nobody really understands. And that's called acupuncture, or traditional Chinese medicine. So we're going to talk about the relevance of what we call anatomical linkages in traditional Chinese medicine as it relates to what your body, the things that you know about your body, the muscles, the nerves, the ligaments, the bones, and all those things, and how they communicate, and why acupuncture, why herbal remedies, why the application of the arts of traditional Chinese medicine really work. And, by the way, that'll be the topic of our presentation this Wednesday evening, our in-house presentation at the Roselle Center for Healing. Your presenter, my guest, your host, Dr. Stephanie Pina. Dr. Pina.
Good afternoon.
Did I get any of that right?
It sounds pretty good to me. I like it. I like the way it sounds. It sounds like I got a lot to handle.
You have a lot to, because you know what? I've been practicing acupuncture for 30-some years. And you are an amazement to me because you really get it and you understand it. And when you came up with this topic, the correlation between Western anatomy and Eastern anatomy, and I said, really? Okay. So I said to you, how are people going to say, raise their hand, I want to come in and I want to check this out? So here's the deal. This is why we're doing this topic for you, meaning our audience, is when you come in, you don't understand really how a procedure in traditional Chinese medicine affects the anatomical structures that you know of that you can put your hands on. Not only the heart and the lungs and the kidneys and all the organ systems, but the muscles and the bones and the ligaments and so forth and the emotions. You know what those are. You can pick up any anatomical book and look at them. But there's this, really? How does it work? Well, that's what Dr. Pina is going to tell us a little bit about today, and she's going to get into it in detail. So whether you've had a gallbladder problem, or you have an allergy reaction, or you have heart palpitations, or you can't get pregnant if you're at that age and trying, there's reasons from Eastern anatomy and Western anatomy, and we're going to try to marriage the two of those together. So, having said that, tell us what the differential pieces are and why we need to talk about this.
Well, I think it's always interesting because we have people that come in all the time and they're familiar with, Western concepts of medicine, muscles and bones and joints, and they're familiar also with the different types of diseases they've been given by different doctors and stuff. But then when they try to see how it connects to Chinese medicine and whether herbs or acupuncture work for them, they basically kind of get lost because there's a lot of different terminology and concepts that don't go together. The idea of even thinking that the heart has to do with our sleep cycle isn't something that you would normally think of. You would think of heart disease and blood flow and circulation, but you wouldn't think of, well, how is the heart affecting my mind? How is it affecting my sleep? that's the type of stuff we're going to go over. How did these connections kind of come about, and making sense of them so that you can actually make more sense of how your body works from a different perspective and how it all connects together.
So to let you all know, this is the revealing. This is what's going to really open your eyes and give you an understanding between the two concepts of medicine, allopathic medicine or allopathic anatomical considerations and how they break down, but also Eastern medicine and primarily why they work and what the interactions are. So if you'd like to, get in detail, get intimate with that, give us a call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Stephanie Pina's presentation this Wednesday evening, the 6th, at 7:30, and we'll be more than happy to host you, because all we require is a reservation. They're all free. It's our gift to you, and just show up. But don't just show up without a reservation, because there's not enough seats. Okay, let's talk about this, because this is fascinating to me. I do it automatically. I don't think about it anymore. I just do. And I upset patients because of that. I get in and I just do what I do, and I don't have a lot of time to, get in depth. That's why we set up what we, our practice, and we have educational modes, we have classes and so forth. But this concept is critical to really understand. So,
well, I think that's funny just to begin with, because when you look at it, even as a physician that's had all these years of training, that has all this practical experience, you go in and you see a patient, and automatically, those thought processes are going through our heads. We're diagnosing, we're seeing where the connections are, we know what we want to look for, and we know how we want to start to treat it, and we know how to individualize it per person when they come in. But the common person when they're coming in as a patient, they're going, okay, I remember back when I was in high school and I learned that, the hip bone is connected to the leg bone and all that stuff. And they have the basics down, but they don't quite see the whole picture. They don't understand why is it that we're asking about, their digestive tract when they're having a headache. Why is it that they're actually kind of wondering why when they push on, if their shoulder hurts and we push on a different muscle completely unrelated to the shoulder, that there's a relationship between there. So it's interesting to kind of also even take a step back, even for myself, to kind of go back to some of those basics and go, oh yeah, there's some deeper connections.
When we talk about somebody that comes in with a headache, when we talk about an allergy reaction, I'll look at that patient, I grab their pulses, I palpate a little bit, and I say, did you get bloated last night after you had dinner? Have you been having problems digesting food? And they'll look at me and say, yeah, a little bit. Why? What's that got to do with my headache? I got a migraine. And we know from the work that we do that gallbladder's involved, and perhaps the liver's involved, and you have to treat those things. And we know that as you get closer to the energy flows, but still, that concept is foreign, not only theoretically, but anatomically to people. So how do you explain that anatomical correlation?
Well, it's interesting because when you look at, say, an acupuncture graph, and you can see things like the gallbladder channel and the liver channel, you can see that they kind of run on the outside of the body. Now, of course, you don't have, those are invisible lines. We can't look at something like a musculoskeletal picture and say, okay, that's where this one muscle is. But there's connections even from the circulation that's deeper in the body, and even from the nervous system that's basically feeding from everything from the brain and the spinal cord that are connecting to, say, those areas where they're having the headache to right down to the digestive tract. They're just all internally. We're just not used to seeing them visually. So the same thing goes with acupuncture. You can use some of those same connections to kind of come up with a treatment and kind of individualize why this person's responding the way they are versus the other person who has no trouble.
So let's, a person comes in and they have, you're talking to them about energetics. You're talking about the way the acupuncture channels run. And you just said that the acupuncture channels are invisible. So does that mean that somebody, hallucinated these channels?
They didn't. They took years and years of clinical experience and also just kind of seeing and observing patients. 3,000 years ago, we didn't have the x-rays and the lab tests and everything else that we have now that can basically tell us where things are and identify what's normal and abnormal. We didn't even know, if someone's pulse, if they were breathing or what their pulse was normal. So when they looked over the body, they saw different connections. If somebody started to have a stomach ache and then they started to have a migraine afterwards, they started to say, maybe there's a connection there. Maybe there's something we should investigate there. They started noticing that if someone, say, has foot pain and stuff and then they start limping or they have a hip pain, maybe there's a connection there. And then they started to notice through different anatomical dissections and stuff that there's muscles and fibers and fascia that connects that whole area. And the same thing goes along with Chinese medicine. They're using some of the same basic concepts. They're just not describing it and putting it on paper the way we did when we learned more about the way the human anatomy and body works.
This Wednesday evening, the 6th of the month, Dr. Stephanie Pina will be your host, your presenter at the Roselle Center for Healing. If you'd like to attend and find out what the correlation is to your different types of problems, why you get a migraine headache, and we call it gallbladder, why you have low back pain, and we say it might be kidney or it might be intestinal tract, but not the organ system itself, that it's the energetic system, or that there's an imbalance, and because of the way you lead your life, you're not getting enough things that are hot, you're not getting enough things. Why does that affect the anatomical considerations of the body? This is an opportunity really that will shed the confusion. You will really get it. You'll really understand it. Dr. Pina is a tremendous presenter, as those of you who have heard her in the past. Give us a call. We'd love to have you as our guest, 703-698-7117. Tell my staff that you'd like to be there, that you'd like to attend. It's really going to be a very interesting presentation, because you're going to see how these things come about. Years ago, the Japanese came up with something called Rotoraku points. And during that time period also, they were able to actually map and trace the acupuncture energetics and saw the energetic flow, and they did it with radioisotope injection.
Yeah, they actually, even before they started to inject in people, they basically would even start to basically put heat on the ends of the fingers and kind of watch to see how long that heat and where that heat went up the fingers, and kind of ask the patients, where do you feel this? And they would use it that way. You know, things have developed now where we can measure the electrical impulses and the currents that are going up to different areas, and even using functional MRIs to basically see when you're pushing on a point or using an acupuncture point, where it affects the rest of the body. They've even done a great study out there where they've actually used points that are totally down by the leg that are known to be known visual points, and then seen the area of the brain fire up where it has visual activity in the visual cortex.
You know, interesting, years ago, my son and his sister and a couple of his buddies went out camping, and it was a really nasty, ugly, cold, wet camping trip. They took out for a couple of days, and they came back, and one of the guys had a tremendous amount of congestion, and he was starting to get sick. And I took him downstairs because I have a treatment area at the house, and I used Moxa on one of the distal lung points on the thumb. And the kids were sitting there and fascinated, because Moxa you have to burn, and I did burning Moxa at the house, and they watched the smoke hang tightly to the skin at the thumb and then begin to move itself all the way up to almost the middle of the forearm. And they were really excited about this. What are you doing? How did that happen? What's going on? So it followed exactly the channel that we are aware of. One of the things that we've done in the office, and I know that you're intimately aware because you've been involved in that, is using thermographic imaging to show the changes in anatomical structures with the application of herbs, with the application of acupuncture, with laser and so forth over the acupuncture points. And that's, to some people, mystifying. How can it change that fast when Western medicine? But that's what we're talking about here.
Absolutely, and it's a perfect example, because there's a great example where they're showing inflammation of the knee from thermographic image, that it shows it's bright and red and there's a lot of heat that's going on there, and they'll use a lot of local points around that knee to basically help decrease the inflammation. It goes down. Well, the problem is when you really look at those pictures, it's also falling around where those acupuncture meridians are going into the knee as well, too. So from an acupuncture standpoint, I know that there's actually a lot more going on with circulation and lymph flow into that area than what the patient's actually feeling just right locally at that area.
888-630-9625. That's 888-630-9625. Love to talk to you on any subject. We're talking about traditional Chinese medicine and the relationship to your structural anatomy and why these things work, which is the topic of Dr. Stephanie Pina's presentation this Wednesday, the 6th of the month at the Roselle Center for Healing. We'd love to have you as our guest. All you need to do is give us a call at 703-698-7117. Tell my staff that you'd like to join us. Dr. Pina will be your presenter, and all we really do require is a reservation, because we don't want to say that we're full. But please call us and let us know that you're coming, and we'll at that point tell you, listen, we're full house, or, so many of you have come and we've had to open up the doors and you sit out the hallway and you can't hear really well, and not a good thing. So give us a call. This is our gift. This is our gift to you. This is a gift to the community. Every week we try to give you a little different perspective, a little different aspect of the pieces of the puzzle, if you will, the why behind what we do. And that's what we're doing today. We're going to get into it much more in depth in a few minutes. There's several of you already on the line. We're going to try to get to you very quickly. Right now, we've got to take a break and listen to some very important information from our sponsors. We'll be right back. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio. Give us a call, 888-630-9625. My guest today, Dr. Stephanie Pina, one of the most amazing intuitive people in the field of Eastern medicine. Dr. Pina is not only an acupuncturist, but she's also a doctor of naturopathy. One heck of a combination relative to the question that's always on the table, why is that? Because she is constantly looking at all those interrelated relationships, and that's what we're looking at today. Dr. Pina, we have several people on the phone lines, but let's go to them first. Laura, are you still there? Hello? Nope. Laura, you can call us back. I mean, I didn't mean to put you off, and I know it takes a long time for us to get back to people. However, with everybody there, if you call back, I'll kind of take you ahead of everybody else. But before, we have several others that we will get to. Let's talk about a little bit about the concept of, which is, and we're going to tie it into what we're talking about with the anatomical considerations, yin and yang, positive and negative, opposites, basically is what we're talking about. You know, there's white and there's black, there's hot and there's cold. But in the human body, anatomically, we talk about opposites as well, paired systems that have to work together for survival.
Absolutely. And even when you're looking at the body, too, you can still use this yin-yang concept of opposites, even when you're just describing the body overall, because you can have the front part of the body is your yin part of the body, the back part of the body is your yang part of the body. It tends to be the warmer part because they used to say that's the part that the sun would always hit. You'd walk with the sun on your back. So it'd be an energetic side where the yin side doesn't get as much heat. So, but there's these paired organ systems in Chinese medicine that work together in combinations. And one of the easiest ones to think about is when we talk a lot about liver, gallbladders, the fact that they're actually right next to each other in the body. And we know that the yin system, the liver is the yin organ because it's the solid organ. Yang organs tend to be hollow organs, so gallbladder, stomachs, intestines, things that hold stuff, basically, or tubes. And this idea that they need to work together. We know that the liver produces bile, and the bile is there to break down food to help with digestion, but it has to be stored somewhere. So it goes and stores into the gallbladder. That's a typical way of kind of looking at it from a conventional medicine kind of physiological way. But when we look at it in Chinese medicine, the two of them also balance each other out because anatomically the liver basically has to sit there and it's the body's detoxifier mentally, chemically, and emotionally as well. It's there to break down how the rest of the world responds to us. And the gallbladder basically is there to help kind of store our emotions and get things out and kind of give us a chance to kind of deal with them. So I always tell people in the morning, if they're waking up really early in the morning, they call it a gallbladder symptom when they're waking up because they have all this indecision going on through the night. They're trying to make these goals over and over again. They just don't know what to do. And all of a sudden they'll come in and say, you know, I wake up at 5 a.m. full of energy. This is totally abnormal. I should be sleeping. The gallbladder's kind of saying, okay, it's time to get up, do your thing. Let's get one goal done and focus on the next one. So when you look at things that are anatomically next to each other, there's also an emotional and energetic connection as well.
They support each other from a controlling point of view. They support each other from a supportive point of view as well. And those are two different terminologies, and I know that confuses people, but one enhances the other, and it also controls the other one from getting too far out of its own balance. And we could talk about that forever, but it's just another piece of the puzzle. And when we consider these things, is, for example, many people who get sick and have respiratory problems, we've talked about this many times, get more sick at nighttime. And it's because the lung channel or the lung organ itself has the highest amount of energetic going to it at that point. So the symptom that's associated with it is going to be worse at night. Mm-hmm. And so anatomically, we begin to give credence, if you will, and some understanding to what traditional Western anatomy says. Because if we look at it as an anatomical piece, with no life to it, I guess that's really what we're dealing with, is from a Western point of view to an Eastern point of view. Western point of view shows hard substances. Eastern point of view shows the substance in motion as it relates to life. Would that be accurate?
Yeah, absolutely. One of the things we can think of, again, we got to go back, and sometimes Chinese medicine, Eastern philosophy, as far as anatomy and health, can be very simplistic or very complicated. It's a different way of thinking about things. When we think about the organ systems now, we've always been told that this is their function, this is how they work, this is what they look like. Well, 3,000 years ago, they weren't doing dissections. They didn't know how it works. I mean, it's almost like Greek mythology and saying that Zeus is making thunderbolts and that's how we get lightning and stuff. There's a way to explain stuff. So they used to kind of say these 5 main yin organs are the main organs of the systems, and then their connecting and supporting organs, their yang organs, are basically the ones that are there as the supporters. So they were able to kind of break down how everything kind of interconnects and how if one's out of balance, the other one might be affected.
Let's go to the phones. Laura finally called us back. Laura, how can we help you? Thank you for calling. Hello, Laura. Laura, are you there? Well, 2 strikes. Can't find her now. 888-630-9625. Love to talk to you on any subject. Let's go to line 2. JD, are you there?
Oh.
JD?
Yes.
Sir, thank you for calling. How can we help you?
I want to pass some kudos on to the Roselle Center in general, Dr. Poe and Dr. Pina in particular. They're my doctors. I've been there several months now. They've made major changes in my life of making the atrial fibrillation, fewer heartbeats, skip beats, weaning me off Lipitor, some other drugs, gluten, alkaline diet, and in-house classes. Plus the main thing, that my heart ejection fraction has increased 10 points since I've been there, and that's right close to 70. And I'm not saying that I'm reversing aging, but it's damn close, because I'm 75 years old, and I also lift weights, and Dr. Poe said that's also part of my regimen here, and he helped fix an L5 that was damaged in an auto accident. So these 2 doctors are geniuses, and they've made major strides in my life.
JD, thank you for your call. I appreciate it. They are fantastic. They're the top of the field. They know their business. They're doing well. Now, the next step is you're going to have to be careful, because then you're going to get involved with Dr. Poe's wife, Erin. Obviously, I have an affinity as my daughter, and she is one of the best in core training exercise. She's a personal trainer. She knows our work. She's done it for years, and now she's in the office. So have Dr. Poe fix you up. We're talking about an interesting subject today, one that is extremely fascinating, and we're kind of taking the veil off the confusion between Eastern and Western medicine, but particularly the anatomical considerations. Here in studio, your host Wednesday night, Dr. Stephanie Pina. If you'd like to join her, 703-698-7117. Tell my staff you'd like to be present. We'll be right back after the news.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live, reminding all women to conduct monthly and annual breast exams. Also consider a thermography scan from the thermography centers as an adjunct to your routine breast exams. Thermographic imaging can detect abnormalities years before a mammogram, and it's safe and non-invasive. For more information, call 888-485-7736 or visit thermographycenters.com. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. We're talking about the differences between Eastern and Western anatomy and how it affects your health problems. And if you have a headache, if you have a migraine, if you have ulcerative colitis, if you have allergies, if you have back pain, you look at it from a traditional, hardcore, very dogmatic Western anatomical representation. Well, there's the other pieces of the puzzle. There's the active integration of those pieces, what we call the energetics of life. And Dr. Pina, my guest, your host this Wednesday evening, is going to clarify all this for us. She's kind of straightening us all out, and it's important that you understand that the body is not dead anatomically. It's not just a hunk of meat, that there is a vibration to it, there's an energetic to it, there's a flow to it. And when a patient asks me, Dr. Pina often said, well, how do you know there's energy? And I ask them, how do you know there's electricity?
Exactly. Energy isn't always something that can be measured, but we know we can feel it around us. We know, we talked a lot about this at the last Ageless Health thing. In fact, that was what my presentation was on, is our energy, is the fact that you know that the body is living being. You don't need to see oxygen in the air to know the oxygen is there that we breathe. The same thing goes with some of the vital forces in the physiological process in the body. We don't have to tell our heart to keep beating. We don't have to tell our muscles to contract when we have a reflex. We have control over certain things, but we know that there's always something there. There's always an energy force that's going through, and whether that's moving blood or oxygen or eating, processing foods and being digestive, there's always something going on. So there's an alive process that connects every other cell to itself.
You know, when you look at a Western anatomy book and you see all the blue lines that represent the veins and the red lines that represent the arteries, and you see different colorations and so forth, when you're looking at a cadaver, a dead piece of carcass sitting there in front of you, which I spent a year in school playing with all the time, you don't see that stuff.
Oh, no, absolutely not. In fact, it's kind of funny to go in there and go, it doesn't look like the book. And I go, well, yeah, in the book they've already placinated it and they made it easy for you so you can go out and there find it. It never looks like that. And the funny thing is, a lot of times structures are even misplaced and in different places and bigger or smaller than what they look like. So it's just like with every person. Everyone's an individual. So even though we know in general what to expect there, we don't know what the differences are going to be with that particular person, and that might be related to the different pathologies that they actually suffer from.
And the same thing is true with the energetic forms of anatomy as well.
Absolutely.
Yeah, no two people are the same. They're generally the same, but they're not the same. We're going to get back to the subject because there's a couple things I want to ask you. However, Laura, are you there?
Roselle.
Thank you. Finally found you.
Call. Okay, I have called you in the past about my blood pressure, and it's on a record high. It's not going down, and I am eating healthy. I exercise as much as I can, but my doctor prescribed Benicor for me, and I am a little concerned about it because I have been hearing that there were lawsuits about Benicor. It causes strokes and heart attacks. So I did not take it yet. So what's your take on this? And the other question is, do dental problems cause high blood pressure? Because I have some dental problems right now.
Let me ask you a question. How high is your blood pressure?
Oh, my God. Sometimes it's 160 over 101. Sometimes it goes to 171. I don't know what's going on. I don't know. I'm very worried.
What have you tried naturally? Anything?
Well, I tried what you told me, the niacin, and I can't find magnesium glycinate at all. I went to Whole Foods. I went to the health stores that sell these supplements, and I could not find it. They only have it in oxide and magnesium oxide, and I don't know what the other one is, but not the glycinate.
Okay, well, glycinate is the most effective, but you can use different forms of magnesium to do the trick. Now, what the magnesium does, it relaxes the arteries. Actually, if you used magnesium aspartate, A-S-P-A-R-T-E, that might even be more beneficial to you. It's not going to hurt you. It may give you, as I said before, a little diarrhea, but it's not going to hurt you. Dr. Pina, with the blood pressure, let's talk about it from an acupuncture point of view. What does that mean? She's told you, it fluctuates within that area. The top side, is it super high? Not really, but it's higher than what we like to see it. The bottom side bothers me more than the top side, being at 100, 101.
Yeah, the same thing. That's the main thing that I go to too. And also, you can also see if there's a difference on one side versus the other too, to see if there's something physically going on that's blocking the blood flow and creating more pressure that gets it going. When you look at it from an acupuncture standpoint, usually high blood pressure can be related to stress. It can also be related to the kidneys themselves, which has to relate back to the adrenals, just how we were just talking about different organ systems correlating with different pathologies a second ago. But we also look at basically the idea that there's an imbalance and things are overdoing it. They're stressed out. They're basically kind of on overdrive. So the body's trying to push as much blood around as possible. It's a normal response. When it starts to get up this high, though, we know that something else is blocking it. So you can look at things like how is the digestive tracts breaking down foods, how are stress responses and adrenal, is there kind of always a on-off switch on the adrenal system going on? We go back to the kidneys, which is kind of funny because the medication that they're going to is basically kind of works on the way that the body kind of produces and keeps blood pressure up and down from a kidney response.
Laura, let me just jump in a little bit, and I wish we had more time to take your question thoroughly. But hold on, I'm going to talk about Benicar for a second. You asked me another question. Yeah. You're aware that Benicar has several lawsuits against it, and the risk is stroke, heart failure, and also particularly more so in people who are type 2 diabetics or have blood sugar handling problems. So if there's anything along those lines, the patient is at significant risk. And the FDA may ultimately take this drug off the market because of these pending lawsuits and the damage that they are aware of that is causing the issue. So your blood pressure, without seeing you, Laura, it's very difficult to tell you go do this because we don't know your whole history. We haven't examined you. We don't know if there's any toxicity levels within the body that are causing some of this. We don't know if there's any neurological structural pieces. So any of those things can cause an issue. I wish we could be more specific. Unfortunately, we can't. What I would encourage you to do is attend Dr. Pina's presentation Wednesday night and talk to her directly and see if she can answer your questions based on the information that's provided. But we treat patients with high blood pressure all the time, and the results can be quite significant. Keith, how can I help you, sir? Thank you for calling.
Hi, good afternoon. I have a question. Sure. I have Meniere's disease, and I also have migraine, though both are controlled with Topamax and Maxide. But my ear specialist asked if I have tried acupuncture, which I have not yet, and I'm wondering if either of you have experience treating Meniere's disease with acupuncture.
37 years of experience treating both migraines and Meniere's. I'll give you just a quick story. The reason that I do what I do today is because my wife had migraines from the time she was 6 years old, and they wanted to fuse her neck to stop the pain from going into her head when she was in her early 20s. And we started her in a chiropractic clinic in Elgin, Illinois, and within 30 days her migraines were gone. Meniere's is a different problem, but it can be effectively treated. Dr. Pina.
Yeah, there's a lot of times there's connections in there that might be related to issues outside of even the head and the ear canal and stuff where they want to talk about being more local. Gallbladder channel runs up in that area, and that can be one of the main meridian channels that you basically use to treat both migraines and Meniere's. Same thing with liver, kind of with its connections. So there's a lot of different ways of looking at it, but the best evaluation is to really sit down and see what's affecting you the most, and do a diagnostic workup first. So it's
okay. I don't have migraines anymore with the medication I'm on, and Meniere's bothers me. I get vertigo maybe once a month or so it's not an extreme case, but my ear specialist said that he believes migraine is an underlying cause of the Meniere's.
It could very well be. It depends on where the migraine is coming from. And the one thing that I'm going to tell you, Keith, is that a migraine is not a deficiency of medication. So there's still an underlying problem that has to be taken care of. Medication blunts the symptom process. It does nothing to resolve the condition. And there's almost no situation that occurs in. So you have to find out, number one, what you're suppressing, what the why is that is. Treat that, and if the two are connected, both go away. But in the way we look at something, we look at it from a structural, chemical, emotional stress point of view, and then we look at 5 systems. We look at the nervous system, we look at the blood system relative to toxicity, the lymph system relative to elimination of waste, the movement of spinal fluid that has to do with the cranial plates and the pelvis and its respiratory pumping action, and then also the acupuncture system. So you look at those mechanisms and you find out whether they're being overburdened or whether they're working properly, and if you can find out the why is that, treat those, and the further upstream that you treat something, the faster something goes away. So the short answer is yes. We've had tremendous amount of experience with what you're dealing with, and the results can be very, very significant. Keith, I appreciate your phone call. Dr. Pina, this Wednesday evening, I know you're going to get into a lot of the why behind this, and unfortunately, medication doesn't solve the problem. I've always, when I lecture, I kid around and I say, headaches are not an aspirin deficiency. They're not. There's a reason. And the problem is that when we start erring to medication all the time to suppress a problem, to get rid of the symptom because it becomes noxious to us, we don't want to deal with it anymore, we start breaking down other body systems as well.
Yeah, I think what ends up happening is we end up relying, even if it's on that one, magical pill that's out there, it's got to be the thing that cures everybody. And everybody's an individual, and so that's why when we talk a lot about coming into either the lectures and learning more about the different ways that, things might be happening, disease processes happen in the body, and also kind of coming in and talking with the doctors, because you really need to be evaluated on one-on-one situation. It's not a matter of, just like what they say, one medication is not the fit-all for every single person, even though that's the way it's always, written in ads or on TV, but same thing goes. Not everybody's suffering from the exact same thing, so why are you out of balance compared to somebody else?
That's why I wrote my book, Ageless Health. Health is a do-it-yourself program, and if you don't have a copy of it, shame on you. You should go get it. Go online, either go to Amazon.com or go to drtomroselle.com, DrTomRoselle. It begins to lay a lot of these concepts out in very simple terms, things that you can apply on a day-to-day basis and give you an understanding that you wouldn't have otherwise. But as Dr. Pina said, that's why we do these programs, but it's also why we do our in-house continuing education programs, is we want you to understand, give you a format to be able to ask questions. Whether you ever came in as a patient or not, you're going to have information that you wouldn't have otherwise. It's critical that you take control of your own health, particularly in the marketplace that we have right now. Julia, how can I help you? Thank you for calling.
Hi, Dr. Roselle and Dr. Pina. I'm calling because I have a girlfriend who was diagnosed in her mid-40s with type 1 diabetes and has had a hard time controlling the type 1 diabetes. Has been under several medications, and now it's come to the point where they are considering to give her a pump. And I'm wondering, would any of your medicines or, medical treatments be advantageous for trying to stimulate the pancreas to do what it's supposed to do?
Julia, let me ask you a couple quick questions. You may not know the answer to these, but
yes.
Has she been diagnosed diabetes insipidus, or did she have it as a young girl as a juvenile onset diabetes?
No, it wasn't as a juvenile. She was diagnosed in her mid-40s with it.
Okay.
And it's type 1.
Okay, anything prior to that? Well, type 1 just simply says the organ system's not working the way it's supposed to. But
right.
the bottom line is that, yes, there's a lot that can be done from acupuncture and from a nutritional point of view, but also from the kind of work that we do neurologically, because if the nervous system or the acupuncture system isn't firing maximally, that organ's not going to work.
Well, just like with any type of diabetes, you have to look at some of the things that would trigger it to begin with, especially when it's adult onset, coming on later on. What's going on with their digestion that all of a sudden they weren't able to basically break down those sugars and get them in and use? Why is the insulin and the pancreas having had the types of reaction that they're having right now? We think about diabetes too, we also start thinking about different types of autoimmune diseases. What's going on with the immune system that's causing those cells not to react? So from a Chinese medicine standpoint, diabetes is actually a three-prong approach. You have to look at it from the spleen and stomach aspect of it, what's going on with the actual breakdown of different types of sugars. You look at it from the kidneys aspect, which has to deal with, again, with the adrenal system. And then you also look at it from the lung aspect of essentially how are they circulating things throughout the body. So it's a little bit more of a complicated situation, and you have to look at what else is going on as far as the immune system overall, too, and kind of use on that to help build up the body.
Julia, the bottom line is, yes, we've had a lot of experience dealing with type 1 diabetics, and if we can ascertain the reason why it was triggered to begin with, and you have to get into a very deep consultation, ask a lot of questions, find out all the underlying ramifications that are associated with the patient. Much can be done. I appreciate it. Listen, come Wednesday evening, join us, and I think we could be very, very specific in answering a whole lot more questions. Grab your friend, give us a call, 703-698-7117. Tell my staff you'd like to attend. We're going to be right back after some very important information. Don't go away. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're here every Sunday at 12 noon, broadcasting to you from 105.9 FM and AM 630. every week is a special week. Every week we try to give you a little different nuance. Every week we try to give you a little something that you hadn't thought about before. It's critical that you take control of your health. That's why we do our in-house programs, as we are this Wednesday evening, March the 6th at 7:30 p.m. at the Roselle Center for Healing. Dr. Pina, Dr. Stephanie Pina, my guest today, your host Wednesday night, will present the anatomical considerations of Eastern and Western medicine, how they relate. But here's what that topic's really about. What that topic's about is getting you to really understand why that headache that you get at a certain time of day actually takes place and what can be done about it. And it's not just your head that's hurting. There's other factors that are involved in it. Why that back pain shows up only in certain time frames. Why that Meniere's problem, if you will, going to one of our callers, is there and never goes away, can only be controlled by medication along with the migraine. There's so much intimacy within the human body that once you understand it and you get it, then you can begin to change anything. Give us a call, 703-698-7117. Tell my staff that you want to attend this Wednesday evening, the 6th of the month at 7:30 p.m., Dr. Stephanie Pina's presentation. We're glad to have you. It's our gift to you. It's our gift to the community. Before we progress, Anne, you've been holding forever. How can we help you? Anne, are you still there?
Is that me?
That's you.
Dr. Roselle, I love your show. I'm usually in the car, and I just think you give a wonderful service to the community.
Thank you very much.
I'm a very healthy 73-year-old, but I suffer with UTIs, and I get them about twice a year. And this has been going on for about 5 years, and it's driving me crazy. I just cannot pinpoint what's causing this.
Okay, there's a lot of reasons why people have recurrent UTIs. I'm going to touch on real quick within a few seconds of some very specific things. Dr. Pina is going to grab it and answer your question, can acupuncture help it? First of all, people who are habitually dehydrated will have much more frequent presentations of UTI and worse UTIs. People who have underlying mold and fungus problems, and you would know that if you were allergic to any kind of mold and fungus, you would have recurrent UTIs. Unfortunately, sometimes hygiene, once it gets in there, we may have a E. coli infection or another type of bacterial infection that gets in and it won't leave because it can't be identified properly. So just using tons of antibiotics doesn't work. And when you have an underlying mold, if you use the antibiotics, you make things much worse than they are.
Also, from an acupuncture standpoint, we want to look at, is there heat in the body that's causing more inflammation? We know that women tend to get more UTIs, especially as they age too, because there's changes in the tissues. So if there's inflammation in the tissue or in that organ system, the urinary bladder, the kidney bladder, even the spleen and the heart, there can be connections in there that basically kind of keep them coming back over and over again. That can be also related to stress.
So there's many different pieces that are interchangeable here. The energetics that relate to the urinary bladder has to do with the kidney itself, the kidney organ, and also the kidney chi. I'll give you real quickly an amino acid that has helped many people that won't hurt you. It's called L-mannose, M-A-N-O-S-E. And what this amino acid does, it walls off any kind of bacteria and stops it from duplicating. And if the immune system is strong enough, it can go after it. The dosage usually is 2,000 milligrams a day. But with your type of situation, I don't think that's going to work by itself. So there's definitely acupuncture considerations. There's probably some dietary patterns, things that you're allergic to, which is one of the things that will cause UTIs. Things that you're not even aware of, things that that are good for you, foods that in your particular situation may be triggering the response. So the short answer is, and yes, definitely there's a lot more that can be done. If we can help you, come to our presentation Wednesday night. We'd love to have a one-on-one with you afterwards and answer your questions. Appreciate your phone call. Let's talk about Wednesday night. Let's put it in the thumbnail. What are you going to do?
Well, we're going to look at some anatomy from a real basic standpoint so we understand what's going on with our body overall. And then we're going to look at it from a Chinese medicine perspective and kind of say, how are these connections always that we talk about, how are they responsible for some of the different diseases and conditions that we have over and over again? How do we have a better understanding of what's going on in our body so that we can not only talk to our doctors better, but actually talk about how do we treat it better as well?
Why is it every time that I have you on the show, I feel like we've left so much on the table? like there's so much more that we could talk about.
I always get the big topics.
I know. Well, it's your fault. You're the one that designs them. But, we could sit here, we could talk about these things forever and take it apart piece by piece, but that's what I know that you're going to do on this Wednesday evening, the 6th of March. Please attend. If you'd really like to know the intimacies, the integration of acupuncture, this is an opportunity for you. And just give us a call, 703-698-7117. Go to drtomroselle.com, check out our website, go to our B&B site, do all those things that will enhance your life. We'll be back next Sunday, 12 noon sharp, bringing you another interesting episode, if you will, of how to take care of yourself. This is Dr. Tom Roselle. See you next week. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.